In this video, we're going to go through a video of me treating a wild Mustang named Marshmallow. His new name is Eddie. Because this horse is very, very reactive, it was hard for me to go at the speed that I would normally go with a domesticated animal, or of course with a human or a child. I use my shonishin, which are contact or non-insertive acupuncture tools. So if you are excited about using Teishin and shonishin in your treatment, this will be a great treatment for you to watch, because wild Mustangs are more reactive than even the most reactive kiddos that I have had in my clinic. I would say the closest kiddos that I have had in my clinic that are like this are definitely the kids who were born addicted to drugs or addicted to alcohol. So very similar in their reactivity. And then also this horse, I think, is in a lot of pain from past trauma. We'll get into that in the video. You'll hear a little bit of the trainer, Stephanie, who is the head trainer of Wild Horse Outreach and Advocacy, talking about this horse. And then also there was a human communicator, which was super cool, on site with us.
I almost would prefer if you went more towards his hind, if you're comfortable.
Just giving me some more feedback about what she was seeing and how the horse was communicating with her. Sometimes as a practitioner, I really love to feel the key. Well, I always love to feel the key of the animals, but you know, I'm never sure if what I'm feeling is just something I'm making up in my head, especially when it's on an animal, because they can't give me that verbal feedback. So it was really cool that I kind of stood back and I didn't say a ton, and I allowed this communicator to tell me what she was feeling. And it was really cool because she actually validated a lot of the things that I was feeling and kind of understood and was reading from this horse. So it was very, very cool. I do hope, for those of you who are new, that you find benefit in this video. If you do, please do hit the like, subscribe button and that little bit bell to be notified of future videos all about Japanese acupuncture and moxibustion and so much more. And without further ado, let's get into the video about treating wild Mustangs and how you can use your Teishin treatment to get deeper into this medicine.
So all of a sudden he gets startled by his tail.
Yeah, it was really interesting because he was showing me some flashbacks, and I was right at his thoracic, and all of a sudden I got a jolt at the same time he got a jolt, because I just stepped in and energetically put myself into that space, and he went like this. And then I got a flash of his helicopters and things from above that he's
Well,
very...
I also think that he has like sudden pains, like shooting pains.
Yeah, he does.
All right, well.
Nerve trauma.
And he is horrible. I mean, he physically struggles with picking up his feet. Mm. Which, if he's out in the SI and he's out, you know, somewhere stuck, blocked in the front legs out in his thoracic sling, that would make sense. Because the front legs are hard for him, too.
All right, you guys, so the very first thing that I do to tune in with the key of the wild ones especially, but any horse really is, you know, and just to catch their vibe, because you have to understand that when you work with these animals, one wrong move, one unforeseen movement, especially with the wild ones, can land you as the practitioner in the hospital. So you really do have to be gentle. And what I'm really looking for here is not only, so blinking, licking and chewing, a lowering of the head, taking deep breaths. These are all signs that he is relaxing a little bit. And so here I just give him a little bit of a break, because he had looked at me a little bit, moved his ears a little bit, and I just wanted to let him know, hey, I'm tuning in with you. But the biggest thing that I'm really looking for with this horse right here at this point is that he lowers his head and looks to me a little bit. And that is because really ideally I would have loved to treat directly on his forehead first. But again, I couldn't touch his forehead first. This horse is very, very reactive, and I would rather stay safe. Now you can see that his whole body is leaning away from me, but the back leg, actually the back right leg, is always cocked at a slightly odd angle or a little bit rested. And that's because more than likely this horse, I do believe, has had some pelvic injury in the past, and or he has SI joint problems. I would not be surprised if he had a broken pelvis at some point. Now I have taken away some of the time of this treatment just to shorten it and make it easier to watch. But again, with the wild ones, you just have to take your time. And it's the same with your kids when you're treating them with shonishin. You have to take the time and allow them really allow them to do the work with you and to be with you in the work. Because if you force the work on them, they're just not going to do well. So here I grab the lead rope and I'm looking again for him to look at me, have some good blinks, and then possibly lower his head. I assist him in helping him to understand what I want him to do, but putting just a little bit of pressure. I would say, you know, maybe 10 grams, 20 grams of pressure, like very, very light pressure on the lead rope going downwards to help him understand that I need you to move your neck. And that is because for this horse, I do believe, and there he had just a slight movement towards me and down. And then we're going to have a lick and chew here because now he understood the assignment. For this horse really to unlock that spine and all the injuries that he's had, also unlock and help to get rid of the forehead headache that I believe he has, he is going to have to help me because, you know, I would say honestly a horse chiropractor would be great for this horse, but he would never stand it. This kind of horse, if you can see the trainer here, Stephanie, is holding on to the lead rope because it's very difficult for this horse to be there without someone helping him to understand. He has a lot of try and a lot of effort. Unfortunately, he is just very, very reactive to humans. This horse, just to give you some background, was in training with Stephanie for 12 months. Most of the Mustangs that she works on gentling with are in with her only for a week, you know, 3 months, 4 months max. This horse was with her for 12 months before going home to adopt her. Now here you can see me trying to approach him. That's just my way of saying, hey, look, this is what's coming. If you go walk directly up to a wild Mustang or even a partially gentled Mustang, they will run away and possibly kick and bite you. It is very dangerous work to just walk straight up to them. They are not a domesticated animal. I really want to stress that here. I do not recommend anyone going up to a wild Mustang on the herdlands and just, or on the HME, I mean, and just treating them. It's not going to go well for you. They will probably run away before they do anything though. So here, this is his definitely harder side. If you can see how he's tilting his head, he really does have a harder time either seeing or possibly processing the information on this side. I think that he has a long-standing headache and that his pole is out. If you can think of the first cervical joint out being on a human is what I assume that this horse has. And so I'm doing really the same thing I did on the other side. It is in place of a root treatment. Ideally for Iyashinomichi, we would do our root treatments on a yin and yang channel of the arm. So that would be a yin and yang channel of essentially the inside and the outside of the front legs. Unfortunately, this horse is not super keen to have you touching his entire body, as you will see with further treatments. And it almost looks like we're not even moving, but if you can see every once in a while, the horse is blinking a little bit. So we have a few blinks, and the blinks are getting longer and longer as I stay there. And that's a sign that this horse is starting to relax a little bit from the sympathetic into the parasympathetic. Notice how he watches the trainer. He watches me, and he is listening, though, to everything that is going on with him.
Turn his head. Oh, yeah, try lunging. It's like you're lunging a board.
I think it's very interesting that he only rests that right hind leg. Even when he's tense, he only rests that right hind leg.
That's also his kicky leg.
That makes sense. That's his most mobile leg. So from my yoga background, that's where a lot of emotion is stored, is in your hips. And that's why so many people have so much back problems, because they can't get their hips released. And there's nothing behind that point that wants to release, and you can see how he actually holds himself. I mean, anatomically, he is built this way, but also he holds himself with a bit of a punch in the back.
Just a little, because I know you can do this. Yeah, I hear exactly what you're saying. And that's why really I would rather treat his neck and his head first. But first he has to trust me a little bit to touch him.
What do you do about that eye?
So I think his eye might get better if he can have a proper well, first of all, his teeth done. And if he can possibly learn to put his head down, I don't know if he'll ever tolerate a full-on adjustment from a chiropractor. Nor do I think that it'll stick, to be quite honest. Simply because he has so much muscle tension and ingrained ways of holding himself that it'll just revert back, is what I see with a lot of horses. You have a very pretty name. You're very pretty, did you hear? That doesn't mean anything. No, I just think you're very pretty.
So here, I'm sorry you guys for not having really good visual of the other side. I did not have a cameraman for this job. But what I'm trying to do, if you see my hand moving, it's a little bit more dispersive. It's kind of a brushing stroke, and then when I hold it in one place, I'm trying to gather and tonify, and you can see that he's still checking me out, but he's starting to relax a little bit. And then you'll see as soon as I back off, he has a good lick and chew, and then he's going to take a deep breath and have another lick and chew. This is really, really important for a horse to relax.
Really good.
And she is on board with, you know, adopting Aurora anyway, even though she's going to have a foal. And if that's going to be a healthy foal, that's all right.
Good job.
I'd also really like to know, if you watch his legs, how much he's moving his legs around. This is something a horse and a child will naturally do to help simulate whatever treatment you're doing into their body and help to regulate it out.
He does have a lot of arthritis as well. More than likely in his hip.
His left hand.
Yeah, he has a lot of arthritis.
Oh, sorry, Maya.
Oh, no, but yeah, I mean, like, when he's able to put his head down, to take a little bit off the pressure on his back, which is why I was asking you, like, how he is with that. I think it'll help him immensely.
All right, you guys, so I did take a little bit of this treatment out simply because I was on the wrong side of the camera. And also I'm going to a new part of this horse, so this horse is also a little bit getting used to me just even being there. So a little bit is just training to say, like, hey, I'm okay. You're okay with me being here. Don't you worry, I'm not going to hurt you. I always have, every once in a while, the trainer move the horse around, or the horse owner move the horse around. I do this with the kids as well. It's the reason why I have a play area in my spaces, because I really do feel sometimes, especially for the smaller children, that it's important for them to move, and then for me to then visually see how that treatment has assimilated to their body. So going to the other side, I'm going back and forth a little bit because I'm trying my best to get a full body treatment with an animal that is obviously not super okay with humans being near it. And here you can see him kind of leaning away a little bit and posturing. Even just bringing my hand out there, he's like, whoa, 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 what you doing? Are you going to hurt me? Again, this is not because of the treatment or me. This horse literally is just very, very fearful of humans. He is still very wild as comparably to a domesticated animal. Here he is trying to give me an answer. He's like, well, what if I look at you? I'll blink a lot. He's trying to give me this good answer, and I'm trying to tell him, I need you to help me to release your neck down, and that's why I'm putting my hand very gently, if you can see how open my hand is, very gently on that lead rope. Now, another thing I'd like to point out is that I do not have the best posture when I'm treating these wild Mustangs. I try my best to keep posture, but especially with the wild ones, you have to keep your posture a little bit away from them in order to make yourself not as confrontational, not as scary, because that's a prey animal will square up to you. One who is not prey, a predator, excuse me, will square up. One who's not a predator who is prey will not square up to you. So it's just utilizing my body to communicate with him a little bit. You can see he's not being super responsive initially, but here his eyes are starting to close a little more. We see a lot less of the white. He's losing a little bit of that muscle tension in his neck. And here, especially above that right eye, you can see how the eye is slowly starting to become looser in the tissue. When you're treating these wild Mustangs, oh, there, right there, that was a beautiful blink. Trying to read these very, very subtle cues is really the difficult and almost slow like molasses. Here we have another great relaxed lick and chew. Now, the reason why the lick and chew is so great for these horses is because it allows them to move their TMJ joint. Oh, here he's going to have a shake. Oh, what I really wanted for this horse to do is just shake his head. If he could shake his head a little bit more violently, which is another way of the horse's releasing, it could really adjust his own spine. And then we have these great blinks, if you can see, almost closing his eye completely on both sides for a long amount of time. That, for a wild animal that is usually prey, is a huge, huge response. And I'm just letting him contemplate life, think about what happened, and help that adjustment sit in with him. And you can see how he's trying to lower his head a little bit more, relax down a little bit more, and almost do a little bit more shaking.
To really teach him how to move himself. I know, sweetie, I'm sorry, but it's so tense here, and we got to get rid of a little of the excess energy. Otherwise, I can't just put stuff in and not take some of it out. It's just too much. Okay? I know, I'm so sorry. I know that feels a little good. It feels a little good.
He's sometimes on the verge of like wanting to quiver his lip a little bit, and then I'm like, no. And he's like, no.
He's like, I just don't touch me, but at the same time, I kind of like that. Maybe, but no. Yeah, so I think with a lot of, that's very smart. That was very smart. That was a really, really brave thing to do. Really brave. Are we done now? That was enough.
He kind of did a little of his own there.
Yes, that was enough. All right, I'll have you walk him around a little bit once.
I almost would prefer if you went more towards his hind, if you're comfortable.
So I want to, but the problem is as far as, okay, so I'm going to be esoteric. As far as the flow of ki or chi is concerned, until I release what's on top, if I go to the back and start putting in what we call tonifying energy, before I disperse what's on his head, what's going to happen is all that energy that I put in, it's kind of like he has a big traffic jam in his upper cervical, right?
You see that?
All right, you guys, I just want to interject really quick here and comment on what Stephanie saw. And I don't know if you guys noticed it, but it was a pop of the back of the spine. It's almost like his spine was adjusting itself a little bit, and it kind of startled him if you didn't see it. So I'll replay that one more time for you guys to see, because these little things are really important to be able, as a practitioner, to catch, but continue talking even if nobody else knows about it. So if you notice, like, I just keep on talking even though I saw what happened, and that's because you have to be able to, as one of my teachers told me, you have to be able to see the whole breadth of the world, everything that's happening, what's happening on the street, you know, what the weather is, all of that, while you feel and talk and touch the patient, so, and treat, of course, as well. So I'll just replay that one more time so you can see it. He has a big traffic jam near his head, right? And so if I start putting in more cars near his butt, it's just going to make the roadway more congested, and it's just going to all traffic jam more towards his head. So yeah, it might benefit his hip a little bit, but as far as my medicine is concerned, in the end, it won't give the result that we need. Okay. So, like, yeah, is that the place that really needs to be treated? For sure. That and on his tummy some, and definitely like the inside of his front left needs to be treated, but...
Alright, you guys, I did skip just a little bit in this treatment simply because I was out of camera angle and there was just no way you would have been staring at the side of horse and not seeing what I was doing. And here you can see how I'm slowly moving towards his hip. In the previous shot that you weren't able to see, unfortunately, I did go a little bit more to his head and try to treat just a little bit on his face. He is very reactive, and you can see as I'm moving towards right now, tonifying the dew on his spine, which would be, I would assume, about dew 8, and you can see how his hip just popped again a little bit. And how he was like, hey, didn't you see that treatment? And he tells me, hey, I want a little bit of a break. But really what I'm doing is I'm trying to push the treatment just a little bit more, push his patience with me just a little bit more, going back up to his withers where there's just a lot of excess, because I'm trying to really get, as I stated in the video, when I was doing the treatment, am trying to get to his hips. I do apologize for having not all of this in the frame again, as I did not have a cameraman. Now, as I take a step back from this Mustang, I want you to notice just how much he's blinking. You'll notice I give him a lot of breaks, and that's because I'm allowing the treatment to settle and for his mind to understand what's happened, and he's just closing his eyes so slowly. For a prey animal, that's a really big deal, because when they shut their eyes, it's a chance for a wolf to come and eat them, right? It's not safe for them. Now here, at the very end of the treatment, I finally try to get to the hip, trying to treat that right hip by treating the left hip. I'm going to end up using my hand. I tried to ask Stephanie, the trainer, to bring his head down in order to be a little bit gentler on him and focus more on the point. Unfortunately, it would have been just a bit too much pressure for him to have two people near him at once. So I use my left hand here to reach up towards that lead rope. And then what I'm going to do is use that left hand actually with a closed hand, a little bit more than a closed hand before you. If you can see, it's not nearly, I'm not pulling or jerking on his head at all. I'm just asking to bring his head down to help adjust his hip. And watch what happens when that hip does adjust. It's going to do something pretty miraculous for him. And here you can see, as he spooks away from me, that moment when he actually adjusts. So I barely put any pressure.
So that kind of concluded my treatment with Marshmallow. I didn't want to do any more than that. Really, after that, the camera wasn't able to pick it up because he was out of frame, but he had an amazing lick and chew. His head was almost halfway to the ground, which was halfway from where it was when we began. And as far as I was concerned, it was really good progress. Now, to the first look of this, it looks like that horse at the end of the treatment is just spooking for absolutely no reason, which I definitely agree. For those people who are horse people watching this, that can happen. But even after that, the horse communicator, I literally felt the joint click. And then also the horse communicator said that she actually visually felt something popping into place, like hips popping into place. And so as far as I was concerned, I thought that was a pretty damn good treatment, because that was the third time in this treatment where his hips had adjusted itself, this third time being pretty dramatic. Now, I have treated this horse since that treatment one time. He is quite far away from me. He's about, I don't know, 40-minute drive away from me one direction. So I will be going and seeing him once a month. I will try on the next one to give you an update. But from what I saw last time, at the beginning of the treatment, his head was way lower. He had much less tension in his body. I was able to treat him at liberty, meaning no one had to hold his lead rope, albeit with some moving here and there for him to get a little spooked. And by the end of the treatment, his head was almost touching the ground as he was like pretty much going to sleep. And I was like, okay, that's a really good treatment for today. His hips also seemed a lot more imbalanced. I did tell the new owner, the new adopter, that I did still believe that he could have a joint supplement on board, whether that's natural or non-natural. At least initially, something like an ibuprofen to and or a joint supplement for a 2-week course. Not that I'm a vet, but just as a suggestion to speak with the vet about that in order to diagnose whether there is an actual pain issue or whether we're just making it up. It's really important when we treat animals. Of course, we don't hear what they have to say about all this. Although I think both the trainer, both myself, and the horse communicator all were on the same page that we definitely did feel that he had pain on board. So that was the treatment. It was a really long, really slow treatment. So thank you so much for staying with me until the end. I really do appreciate your time, energy, and effort learning this amazing medicine called Japanese acupuncture and moxibustion. Of course, there are so many styles in between Japanese acupuncture and moxibustion labels, but the foundations are always the same. Learning how to hold the needle correctly, insert it correctly, how to burn your moxa correctly, how to learn how to do dispersing and tonifying moxa, and dispersing and tonifying acupuncture treatments with variety. So if that sounds like something you are interested in learning, please do check out ShinKyu University. Again, it is a full mentorship course, that it gives you mentorship throughout your membership, which is lifetime long. And I would very much enjoy to have you within the community. If you're interested in that, there is a link in the description box below. I really do hope that you found some benefit from this video. And don't forget to like, subscribe, and hit that little bell to be notified of future videos to come out. Also, if you're interested in future videos, do check out this video right over here.